First question I want to ask you is something that we've kind of been discussing in the newsroom all day. How do you pronounce this new variant? Because I've seen about 3 different pronunciations of it.
Well, Omicron is how I say it. So I think that's probably what people are using, but you'll probably hear it a number of different ways.
You said Omicron?
Omicron.
Omicron. Okay. That's how we're going to use it for this interview then.
All right. All right.
So first, I just want to ask you, what's the top thing people need to know about Omicron variant?
Well, I would say the top thing is people need to understand that we still don't know everything. I mean, this all came about very quickly. Even over the last 72 hours. I mean, the variant was just identified by a South African scientist, in the late part of this month. Looking back, probably the first case was in early November. We are seeing it in a number of countries now across the globe, including a couple of cases in Canada, and I think that's probably what's got people in the U.S. nervous. But I would say right now we need to take some time to really understand what is this going to mean. We've seen other variants, obviously. I think what has people most nervous is just what the impact of Delta was on us and our communities. And so everybody has a heightened sense of awareness and a little bit of fear that there could be another Delta coming along, so to speak. But I think right now it's a little early to panic, but certainly not unreasonable to be cautious.
And that's kind of what led me into my next question is, we've heard the Delta variant, and that obviously threw the entire response to COVID for a loop and sent us into another surge. It affected kids that were younger when we were used to it always affecting the older population. There is concern, though, because the U.S. has already started kind of blocking off travel to certain countries. So what level of concern should people be at right now as we just finished up Thanksgiving and we're heading into the Christmas holiday season?
Yeah, I mean, I think it's good to fall back on our prior experience. I mean, Delta by far hit us very hard, and I think it's sort of, unfortunately, it's the same refrain you've heard us talk about before. We need people to be vaccinated. We need people to be cautious, and people were tired of that message, but the message hasn't changed. Now, the thing we have to understand about Omicron is it originated in South Africa. They've seen cases rising there. We also have to understand, though, that the vaccination rates there are low compared to the US. So they have somewhere between 25% on the low end to maybe as high as only 30% of their population vaccinated. If you look at their healthcare population, it's somewhere in the 27% range. So you're seeing much lower vaccination rates. We're seeing Omicron, at least, again, this is just early information, but in a younger population, which tends to even have lower vaccination rates than that. And so, I think it's just a time for everyone as we go into the holidays. Like you said, we're going to be indoors, we're going to be around more people. We know the global nature of this virus, it travels, unfortunately. And so I think people just need to continue to exercise caution, get vaccinated if you're not. Try to be around people that are vaccinated. Just be safe with your decisions as you go into the holidays, and feel comfortable having conversations with your family members and about those things as you head into bigger gatherings.
How does Africa's vaccination rate, because you said it was in the 20 to 30 percentile compared to the US?
So we're in the U.S. as a whole around 69%. Again, they're about a third of that. Basically, I should say that about 68% first dose, about 59% fully vaccinated in the U.S., and that's comparable to what we're seeing in Texas as a whole. So we still have a ways to go in Texas and the U.S. as well, but much higher rates. And then our elderly population, thankfully, who we consider our most vulnerable, is much higher than even that.
The thing that kind of sparked my focus when I saw the first couple of news about this variant the past week, was that a couple of reports saying it doesn't stand up to the vaccine, or it kind of overpasses the vaccine.
Sure.
Whereas other variants were blocked off by it. Do we know specifics on that yet?
We don't, and again, I think the scientists that are closest to this are asking us to exercise caution as we try to think through this. The thing that's concerning about Omicron, is one, we're seeing it spread to a number of countries relatively quickly, and it's just the number of mutations. So it has overall about 50 mutations. Somewhere, depending on what literature you look at, 30 to 32 of those mutations are in the spike protein, and that's really kind of where the vaccine is directed. And so there's some concern that the vaccine may not be as effective against Omicron. Again, I would say that's very early speculation based on what we're seeing, based on the mutations, not on any sort of real life exposure to Omicron and big populations of people that are vaccinated. So everything is speculative right now, and that's why I would ask people to not get too panicked. And there's no reason to believe that the vaccine won't have some impact. People are already saying about Omicron and vaccinated populations that the cases that they are seeing are milder cases. So again, that's again the same thing we said with Delta. If you're vaccinated, you may still get Delta, but you won't get it as bad as other people who are unvaccinated. No reason to believe that that's going to be different with Omicron at this point.
And that kind of led me into my next question is, there has been vaccine hesitancy over the past year and a half. And with some of these early reports saying, Omicron might be stronger than the vaccine and it may just overpass it, how do you still encourage people or fight for the fact of the vaccine is the right answer? Is that still the kind of path we're wanting people to take?
It absolutely is. I mean, I think everybody knows by now that there's two paths to some type of immunity against the coronavirus. One is the vaccine, two is to get infected. We know the risk of getting infected, and it's too high, in my opinion, to gamble basically and hope that you get natural immunity. Now, people who have already been exposed and had an infection, they ask, well, what's the value of the vaccine? The studies have shown that people who have been infected and are vaccinated have the highest level of immunity of anybody in our population. So I would say don't take a chance and try to get natural immunity. Get vaccinated if you haven't had the coronavirus and you want protection. If you've already had it, I would still recommend vaccination because you're protecting yourself even further at that point. So there's just no downside to getting the vaccine. It's the best tool we have to try to achieve broad levels of some type of immunity. And as we talked about, we believe if we can do that, that makes it harder for these variants to even emerge within the population. If we have more people that are protected, they just can't spread as easily.
I know that this new variant, the Omicron variant, has been found in other countries. It has not been reported yet in the US, but what's the likelihood that it's already here?
I would say from prior experience, it's high. I mean, if you listen to public health officials, they're already speculating that it probably is in the US and we just haven't identified it yet. There's just no reason to believe with the level of global travel that we have today that we're going to be exempt from, getting some cases of Omicron. Now, again, I would say, we've had other variants in the US. This for a variant to be dominant right now, it has to displace Delta, and other variants have not been able to effectively do that. So again, we're just going to have to kind of watch and see what happens with this. But I think it'll end up in the US in the coming days.
What's your level of concern right now, given the fact that even you admitted, there's a lot of things that are unknown. So how concerned are you about the Omicron variant?
Well, I try to keep it balanced. I mean, my concern is, I'll say just based on what we've been through, healthcare workers are, hoping for an extended period of time that we can go without a surge. And so my concern is really related to my workforce and what impact another surge would have on them. So it may be higher than the average individuals, but at the same time, like I said, we've seen other variants come and go. And at this point, I'm just going to continue to watch the data. It's going to take several weeks for us to know if this is going to be something significant or not. So.
And what's the likelihood we see a surge around this time? I mean, we're already gathering for the holidays. We saw a surge this time last year. Now we have a new variant potentially in play. Are we going to see another surge probably?
It's hard to say. I mean, the numbers have come down, but they haven't come down as far as they did after prior surges. So I think we're all have a little bit of heightened anxiety that we're going to see the numbers tick up just based on what you said. People are going to start to gather more going into the holidays. It's human nature that we've probably relaxed some of the things that we did in the past going into that, and we want to be around each other. I think we'll see numbers climb a little bit going into the holidays if Omicron doesn't become significant. Will it be a full-blown surge? It's just too early to tell at this point. But I would tell people, please exercise caution. Do everything you can to protect yourself. And if you're responsible about those choices, then I still think you can have time with your loved ones around the holidays as long as everyone is safe.
I mean, it's tough, I think we all still talk about it. This thing started almost 2 years ago. We heard it's 2 weeks to slow the spread. We all thought we'd be out of the office for maybe a month, month and a half.
Right.
And now 2 years later, we're still here. We're still wearing masks. We're still social distancing. And people are just tired.
I fully understand it and feel those same emotions with my family members, with, like I said, with our workforce. So I understand it. And it's not my attempts to try to get people to protect themselves is certainly not a lecture. It's just a hope that we can all get on the other side of this, because this is really what we want. I mean, but to do that, we do have to act as a community, and we've got to make those choices, sometimes difficult, sometimes tiring. But if we do that, I do think that we can get past this and like you said, eventually look back on it instead of feeling like we're still somewhat in the middle of it, which is, a feeling that unfortunately just hasn't gone away over the last 18 months, coming up on almost 2 years in March. I mean, we're all tired and ready to be beyond coronavirus. I know that.
With the Delta variant, I know it almost targeted, for lack of a better term, the younger population, which we really hadn't seen with other variants. Is there any idea what age group the Omicron variant will affect the most, or is that just too soon to tell?
Yeah, I think it's still too soon. Again, like I said, people are, everybody's scrambling right now to try to pattern this particular variant, and they are saying right now they're seeing it more in a younger population. But again, that correlates with the higher level of unvaccinated. So I don't know that the age correlation may be a little bit of a false equivalency, and it's really based on the vaccination status. But I think it's too hard to tell. Like I said, even in our own country, if you look at vaccination rates between our 65 and above and our younger population, you see a difference there. So we'll just have to see. I mean, I think it still points to the same thing. It's going to take a few weeks, if not a little longer, to kind of really understand what this virus is going to do. And in the meantime, people just need to continue to ask themselves, have I done everything I can to protect myself? And recognize that, we may not be as far beyond this as we would hope. I'm not saying we're not, but we don't know yet is the unfortunate answer.
Anything else you think people need to know as now? I mean, kids can now get vaccinated, well, 5 to 11-year-olds. Most of us are now eligible to get our booster shots. What else do people need to know about this new variant and just kind of COVID in general?
I would try. I know it's hard because there's so much information out there, but I would just kind of continue to try to pay attention. I mean, as you said, I think everyone has, pandemic fatigue or whatever name you want to give it. But don't take your eye off the ball, so to speak, altogether just yet. Try to continue to watch things, pay attention to where you are and what communities you're in and who you're around and those sorts of things. So again, it's not a reason to say the holidays are not going to happen. I still think we'll have time to be with each other, but we just have to continue to pay attention and try to make responsible choices.